Hey there. Ready for a deep dive into the world of vertigo? Imagine this. You're a busy GP,
Okay,
and a patient walks in describing that awful spinning sensation. We're going to equip you with the knowledge to get that patient feeling steady on their feet again.
that's right. We're breaking down the latest expert recommendations on vertigo treatment,
Oh.
focusing on what's most practical and effective for you in a general practice setting.
Okay, let's unpack this. First things first, how do we make sure we're dealing with true vertigo and not just run-of-the-mill dizziness?
You're right to highlight that distinction. Vertigo is more than just feeling lightheaded. It's that distinct illusion of movement,
Yeah.
either of yourself or your surroundings. Patients might describe a spinning sensation,
Yeah.
tilting, swaying,
Oh, wow.
or even a feeling of being pulled to one side.
So we need to really listen to how the patient describes their symptoms.
Right.
What else should we be considering during that initial evaluation?
Timing is key. Is the vertigo constant or does it come in episodes?
I
If
like
it's
that.
episodic, how long do those episodes last? Seconds, minutes, hours. We also need to know what brings on the vertigo.
Okay.
Does it happen with certain head movements, changes in position, or is it seemingly random?
So we're looking for patterns and triggers.
Yes.
What about the impact of the vertigo? How severely is it affecting their daily life?
Exactly. Can they work, drive, even just walk around safely?
Yeah,
This helps us gauge the severity and urgency of the situation.
makes sense.
And of course, we need to know about any other symptoms they're experiencing, like
Mhm.
hearing loss, tinnitus, or neurological issues. All these clues help us pinpoint the underlying cause of the vertigo,
Okay,
which is essential for effective treatment.
makes sense. So let's say we've gathered all this information.
Okay.
How do we start narrowing down the possible causes of vertigo?
We can break it down into three main categories:
Okay.
peripheral,
Yeah.
central,
Mhm.
and other. Peripheral vertigo, which is the most common type, originates in the inner ear or vestibular nerve. Think conditions like benign paroxysmal positional vertigo or BPPV,
Okay.
vestibular neuritis, and Meniere's disease.
Okay, so those are our inner ear usual suspects. What about central vertigo?
Central vertigo is less common
Right.
and stems from a problem in the brain, specifically the cerebellum or brainstem.
Got it.
This could be due to things like stroke, multiple sclerosis, migraines, or even tumors.
Those sound more serious.
Yeah.
What clues might tip us off that we're dealing with a central cause rather than a peripheral one?
Good question. With central vertigo, the dizziness might be less intense,
Okay.
but it often lasts longer and can be accompanied by more neurological signs like double vision, difficulty speaking,
Right.
or limb weakness. It's a red flag situation that warrants immediate investigation.
Definitely a time to consult with a neurologist.
Right.
What falls into that other category?
That encompasses a wide range of possibilities, from medication side effects
Mhm.
to cardiovascular issues, even anxiety disorders. Sometimes it's a matter of carefully reviewing their medication list
Right.
or considering if the dizziness is more related to feeling faint or lightheaded rather than true vertigo.
So a real detective job.
It is.
But once we've cracked the diagnostic code,
Yeah.
what are the main treatment approaches we can use?
The good news is that we have a range of effective options, and often it's a multi-pronged approach.
Okay.
First and foremost, we want to treat the underlying cause whenever possible.
So if it's BPPV,
Right?
we'd use the Epley maneuver to reposition those pesky ear crystals.
Exactly.
If it's vestibular neuritis,
Yeah.
we might consider corticosteroids to reduce inflammation.
Exactly. But while we're working on addressing the root cause, we also need to help patients manage those often debilitating symptoms.
Right, because acute vertigo can really knock people off their feet.
It can.
What are our go-to options for symptomatic relief?
Primarily medications that work on the vestibular system
Okay.
and medications that control nausea and vomiting.
Okay, let's break those down. What are some specific medications that can help calm things down in the inner ear and the brain?
One of the most commonly used medications is meclizine,
Okay.
an antihistamine that's generally well tolerated and is even considered safe during pregnancy.
Mm-hmm.
It can help reduce the spinning sensation and accompanying nausea.
Meclizine's a good one to have in our toolbox.
It is.
What other options do we have?
If meclizine isn't providing enough relief, or if anxiety is a prominent feature,
Right.
benzodiazepines like diazepam or lorazepam can be helpful, but we need to use those cautiously due to their sedative effects and potential for dependence.
So short-term used only for those tougher cases.
Right.
And what about tackling that awful nausea that often comes with vertigo?
Ondansetron, especially the orally disintegrating form, is a great choice for that.
Okay.
It works quickly and can be a lifesaver for patients who are struggling to keep anything down.
So we've got options for managing both the dizziness and the nausea.
Yes.
But I imagine medication is just one piece of the puzzle.
Absolutely. Along with medications, we need to think about vestibular rehabilitation,
Right.
a specialized type of physical therapy that helps the brain adapt to problems with the balance system.
Vestibular rehab.
Yes.
It's amazing how the brain can rewire itself even in the face of some inner ear damage.
It truly is remarkable, and there's strong evidence that vestibular rehabilitation can significantly improve symptoms and quality of life for many patients with vertigo.
So how does vestibular rehabilitation actually work? What's the magic behind it?
It's not so much magic as it is harnessing the brain's incredible plasticity.
Okay.
Vestibular rehabilitation works on several levels. It encourages adaptation, meaning the brain learns to rely more on visual cues and other senses to compensate for the faulty signals from the inner ear.
So it's like the brain is finding workarounds,
Right.
creating new pathways to maintain balance.
Exactly. Vestibular rehab also helps facilitate what we call strategic substitution.
Okay.
This means other reflexes in the body step up to help stabilize gaze and maintain balance.
Oh.
For example, the cervico-ocular reflex, which coordinates head and eye movements, can become more dominant to compensate for vestibular loss.
So the body's backup systems kick in. It's fascinating how adaptable our bodies can be.
It is. And lastly, vestibular rehabilitation helps counteract the negative effects of inactivity.
Okay.
When people are dizzy and afraid of falling, they tend to avoid movement,
Right.
which can lead to physical deconditioning and actually worsen their symptoms. Vestibular rehab encourages safe, gradual movement to break that cycle.
So it's not just about retraining the brain, it's also about retraining the body to move with confidence again.
Precisely. And the great thing is, it can be tailored to the individual patient.
Right.
The exercises used in vestibular rehab will vary depending on the underlying cause of the vertigo, the severity of the symptoms, and the patient's overall physical condition.
So a personalized approach is key.
It is.
But before we dive into the specifics of vestibular rehab, I think it's important to address another factor that can significantly impact a patient's experience with vertigo.
Psychiatric comorbidity.
You're absolutely right. We can't ignore the mental and emotional toll that vertigo can take.
Right. It's not just about the physical symptoms.
Yeah.
It's also about the anxiety, the fear, the frustration, and the impact on their daily life and relationships.
Exactly. And studies show that anxiety, depression, and panic disorder are diagnosed in a significant percentage of patients with vertigo.
Wow.
These mental health conditions can amplify the impact of the vertigo, making it feel even more debilitating.
So we need to be aware of and address those psychological components as well. It's about treating the whole person, not just the spinning sensation.
Well said.
Yeah.
And sometimes simply acknowledging and validating their fears and anxieties can make a world of difference.
Just letting them know that they're not alone and that their feelings are understandable can go a long way.
Absolutely.
Ah.
And in some cases, we might consider incorporating relaxation techniques like deep breathing exercises or mindfulness meditation into their treatment plan. Those can be powerful tools for managing stress and anxiety, which can definitely exacerbate vertigo symptoms.
They can. And if the mental health concerns are more significant, referral to a mental health professional is always an option.
It's about being a good advocate for our patients and making sure they're getting the comprehensive care they need.
Exactly. And speaking of comprehensive care, let's circle back to medications for a moment.
All right, let's dive a bit deeper into the specifics of those drugs we use for symptomatic relief.
Okay. Let's start with meclizine,
Okay.
that trusty antihistamine we mentioned earlier. It's a first-generation antihistamine that blocks the action of histamine, a chemical involved in allergic reactions.
But how does it work for vertigo if it's an antihistamine?
While the exact mechanism isn't fully understood,
Okay.
it's thought to suppress vestibular activity and reduce nausea by acting on certain receptors in the brain.
So it's calming down those signals from the inner ear that are causing the spinning sensation.
Exactly. And meclizine is generally well tolerated, even at higher doses.
Are there any side effects we should be aware of?
The most common one is drowsiness,
Right.
which, as I mentioned before, can actually be helpful for some patients, especially those with anxiety.
Yeah.
But for others, it can be a drawback if they need to stay alert and function throughout the day.
So it's about weighing the benefits against the potential side effects and choosing the right medication for each patient.
Right.
Are there any other antihistamines besides meclizine that we might consider?
Dimenhydrinate and diphenhydramine are sometimes used, but they tend to have stronger sedative effects.
So meclizine might be our best bet in most cases.
Probably.
Now, what about those benzodiazepines like diazepam and lorazepam?
Okay.
What are their strengths and weaknesses when it comes to treating vertigo?
They work by enhancing the effects of GABA,
Mm-hmm.
a neurotransmitter that has calming effects on the brain.
Right.
This can be particularly helpful when anxiety is a major component of the vertigo.
Mm-hmm.
However, benzodiazepines have a higher potential for side effects, like drowsiness, dizziness, and impaired coordination.
Which, ironically, could worsen the very symptoms we're trying to treat.
Exactly. And we also need to be mindful of potential interactions with other medications, alcohol,
Right.
and even certain foods. So benzodiazepines are a tool we can use, but with caution and for short periods.
Absolutely. Now let's talk about ondansetron, our go-to antiemetic.
Okay.
I know it's a serotonin 5-HT3 receptor antagonist,
Yes.
but can you explain what that means in simpler terms?
Sure. It basically means that ondansetron blocks a specific type of serotonin receptor in the brain and the gut
Yeah.
that's involved in nausea and vomiting.
So it's directly targeting the nausea pathway.
Exactly. And what makes ondansetron particularly useful for vertigo is that it comes in an orally disintegrating form,
Right.
which is ideal for patients struggling to keep pills down.
So it's convenient, effective, and well-tolerated.
It is.
Are there any other antiemetics we might consider?
Prochlorperazine and promethazine are sometimes used,
Okay.
but like the other older antihistamines we discussed,
They tend to cause more drowsiness.
so it seems like ondansetron might be the winner in most cases.
Yeah,
But as always, it's about individualizing treatment.
you got it. What works for one patient might not work for another. It's about careful assessment, understanding the nuances of their symptoms,
Right.
and choosing the best medication for their specific situation.
Okay, we've covered a lot of ground already.
We have.
We've tackled diagnosis,
Uh-huh.
discussed medications for symptom relief,
Yes.
and touched on the power of vestibular rehabilitation.
We have.
And we've emphasized the importance of considering the whole person, addressing any coexisting mental health concerns that might be amplifying their vertigo.
We have.
But before we wrap up this first part of our deep dive,
Okay.
I want to hear more about that patient perspective. Vertigo can be a truly disorienting and frightening experience.
It can.
How can we best support our patients through that?
You're absolutely right. It's essential to approach our patients with empathy and understanding.
Imagine feeling like the world is constantly spinning.
Yeah.
It's no wonder that people with vertigo often experience anxiety,
Yeah.
fear, and even depression. They might become afraid to leave their homes, drive, or even walk unassisted.
It can be incredibly isolating and have a huge impact on their quality of life.
It can. And that's why it's so crucial to take the time to listen to their concerns,
Right.
validate their experiences, and answer their questions patiently.
It's about building that rapport and trust so that they feel comfortable opening up to us about their struggles.
Exactly. And remember that communication is key. Explain the nature of vertigo in terms they can understand.
Right.
Discuss the treatment options available.
Right.
And set realistic expectations for recovery.
So empower them with knowledge and involve them in the decision-making process.
Exactly. And don't underestimate the power of reassurance. Let them know that you're there to support them throughout their journey and that there's hope for improvement.
Sometimes just knowing that they have a healthcare provider who cares and is on their side can make all the difference.
It can. Now let's shift gears a bit and delve into some specific strategies that general practitioners can use to optimize patient care when it comes to vertigo.
Okay, let's get practical. What are some actionable steps we can take to ensure our patients are getting the best possible care?
First and foremost, take a thorough history.
Okay.
Ask detailed questions about the onset, duration, and characteristics of their dizziness.
Okay.
Is it a spinning sensation, a feeling of lightheadedness, or something else?
Okay.
When does it happen? What makes it worse? What makes it better?
So really digging deep to understand the nuances of their experience.
Exactly. Next, perform a comprehensive physical examination,
Okay.
paying close attention to the neurological and vestibular systems.
Okay.
Check their gait, balance, eye movements, and reflexes.
Looking for any clues that might point to the underlying cause.
Precisely. And don't forget to assess their mental health. Ask about symptoms of anxiety, depression, or panic attacks.
So incorporating that mental health screening into our routine assessments.
Exactly. Based on the history, physical exam, and mental health assessment.
Okay.
You can then determine the appropriate diagnostic tests.
All right, we're back for the final leg of our vertigo deep dive. We've covered so much ground already: diagnosis, medications, vestibular rehab,
Yes.
even the psychological impact of vertigo.
Right.
But there's always more to learn, right?
Absolutely. Vertigo is a complex condition, and our understanding of it is constantly evolving.
Speaking of evolving, you mentioned some exciting technological advancements in the last segment. Let's dive a bit deeper into those, especially virtual reality.
Okay.
It seems like VR has the potential to revolutionize vestibular rehabilitation.
I completely agree. VR offers so many advantages over traditional vestibular rehab exercises.
Okay.
For one, it's incredibly immersive.
Hmm.
Patients can step into virtual environments that simulate real-life situations, like
Right.
walking down a busy street or navigating a crowded store.
So it's like a safe and controlled way to challenge their balance and get them used to those situations that might normally trigger their vertigo.
Exactly. And because VR is so engaging,
Yeah.
it can actually make therapy more enjoyable for patients.
Right.
Let's face it, traditional vestibular rehab exercises can be repetitive and, frankly, a bit boring.
Right.
But with VR, it feels more like playing a game than doing therapy.
That's so cool. And I imagine that increased engagement leads to better adherence to the therapy program,
Yes.
which ultimately translates to better outcomes.
You're absolutely right. We know that patient motivation and adherence are key factors in the success of any rehabilitation program.
Right.
And VR seems to have cracked the code when it comes to keeping patients engaged and excited about their therapy.
I'm also fascinated by the potential of VR to personalize therapy. Can you talk a bit about how that works?
Sure. With VR, we can tailor the virtual environments and challenges to the individual patient's needs and abilities.
Okay.
For example, if a patient is struggling with gaze stability,
Right.
we can create VR scenarios that specifically target that skill,
Okay.
like having them track a moving object while their head is still or while they're walking.
So we can gradually increase the difficulty level as the patient progresses, pushing them just outside their comfort zone to maximize their recovery.
Exactly. It's all about finding that sweet spot where the challenge is significant enough to promote adaptation, but not so overwhelming that it triggers anxiety or setbacks.
Right.
And with VR, we have so much control over those parameters.
It's like having a virtual therapist that can adjust the therapy in real time,
Right.
responding to the patient's progress and needs.
That's a great analogy. And we're also seeing the emergence of VR programs that can be used at home under the guidance of a therapist.
Oh, wow.
This can increase access to vestibular rehabilitation for patients who might not live near a specialized clinic or who have difficulty traveling.
That's a huge benefit. It's
Yeah.
all about breaking down those barriers to care and making sure that everyone who needs vestibular rehab can get it.
Exactly. Now, beyond virtual reality, there are other technological advancements that are making waves in the world of vertigo treatment. For example, we're seeing increasingly sophisticated wearable sensors that can track head movements with incredible precision.
Those sound interesting. How are those sensors being used in vertigo management?
In several ways. First, they can help us objectively measure a patient's balance and gait,
Okay.
providing valuable data that can inform our diagnosis and treatment decisions.
Okay.
Second, these sensors can provide real-time feedback to patients during vestibular rehab exercises,
Correct.
helping them to correct their movements and improve their form.
So it's like having a virtual coach right there with them, guiding them through their therapy.
Exactly. And third, these sensors can be used to monitor patients' progress over time, allowing us to track their improvement and make adjustments to their treatment plan as needed.
It's all about using technology to personalize therapy and optimize outcomes. I'm really excited to see how these technologies continue to evolve and improve patient care in the years to come.
Me too. It's a fascinating time to be involved in the field of vertigo management with so much innovation happening.
Now, shifting gears a bit, I want to talk about something that's often overlooked when we discuss vertigo: prevention.
Okay.
Are there any steps people can take to reduce their risk of developing vertigo in the first place?
That's a great question. While we can't prevent all cases of vertigo, there are definitely some lifestyle factors that can influence risk.
Okay.
Maintaining good overall health is crucial.
Right.
This means eating a balanced diet, getting regular exercise, and managing chronic conditions like diabetes and high blood pressure.
So a healthy lifestyle is a good foundation for vestibular health, just like it is for overall health. Makes sense. What about specific preventative measures?
One of the most important things is to protect your head from injuries. Head trauma is a significant risk factor for vertigo, as it can damage the inner ear and vestibular nerve.
So wear helmets when biking, skiing, or engaging in any activity where there's a risk of head injury.
Exactly. And be mindful of medications that can have ototoxic effects, meaning they can damage the inner ear and potentially cause vertigo.
We talked about aminoglycoside antibiotics earlier. Are there other medications we should be aware of?
Certain chemotherapy drugs, loop diuretics like furosemide, and even some over-the-counter pain relievers like aspirin and ibuprofen can potentially cause ototoxicity, especially at high doses or with prolonged use.
So it's always a good idea to talk to your doctor about potential side effects of any medications you're taking, especially if you have a history of dizziness or vertigo.
Absolutely. And if you do experience any episodes of dizziness or vertigo, don't ignore them.
Right,
See your doctor promptly for a proper evaluation.
right.
Early diagnosis and treatment are key to preventing long-term complications and improving outcomes.
Couldn't agree more. Early intervention is always the best approach.
Ah,
Now, before we wrap up our deep dive, I want to circle back to the crucial role of general practitioners in managing vertigo.
absolutely. General practitioners are often the first point of contact for patients experiencing dizziness and vertigo.
Right.
And you play a vital role in recognizing the signs and symptoms, conducting a thorough evaluation, and initiating appropriate treatment.
We have the power to make a real difference in our patients' lives.
We do.
Mhm.
And by staying informed about the latest advancements in vertigo diagnosis and treatment, we can continue to provide the best possible care.
To our listener, we encourage you to keep learning, exploring, and asking questions.
Yes.
Medicine is a constantly evolving field, and there's always something new to discover.
Absolutely.
You don't have to be a specialist to make a difference. Embrace a holistic approach, stay informed, advocate for your patients,
Right.
and you'll be well equipped to help them navigate the challenges of vertigo.
Couldn't have said it better myself.
Until next time, keep diving deep,
Yeah.
keep those brains engaged, and remember, even if the world feels like it's spinning, you've got this.